There is roughly $5,000 a year sitting in a federal program with your name on the eligibility list right now. Medicare will not call you. Social Security will not write you. Nobody at your pharmacy is required to bring it up. And here's the part that should make you angry. You are not being denied. You were never told to ask. That's the first of 3 things happening in 2026 that almost nobody over 60 is being told about. Not because anyone is hiding them, because the system was never built to volunteer information. It was built to answer questions, and only the questions you already know to ask. One of the 3 has a hard expiration date on it. One of them can cost you an entire Social Security check if you retire in the middle of a year and assume the wrong rule applies to you. And one of them, millions of people have already been approved for and never claimed. Let's start with the check. Here's who this video is actually about. If you retired partway through this year, you worked January through June, then stopped, there is a Social Security rule that decides whether you get paid for the rest of the year. Most people apply the wrong one to themselves, not because they're careless, because the wrong one is the one Social Security explains first. If you have ever been told you make too much to qualify for help with your prescriptions, and you accepted that answer, the rules changed underneath you in 2024. The answer you were given may no longer be the answer that applies. And if a doctor has ever mentioned a weight loss drug to you and you didn't even ask the price because you already assumed Medicare doesn't touch those, that assumption was correct for years. It stopped being correct on July 1st. 3 separate systems, 3 separate rules. Not one of them will reach out to you. That is not a conspiracy. Nobody sat in a room and decided to keep this from you. It's worse than that in a way. It's just how these agencies are built. They process what arrives on the desk. They do not go looking for the people who qualify and haven't filed, which means the only person in this entire arrangement whose job it is to catch this is you. Which of those 3 just described you? First one, second one, third one. Tell me below. I read these. Here's the situation that catches people. You're 64. You work the first half of the year and earn $40,000. Then in July, you retire and file for Social Security. You call or you read the page and you find this. If you're under full retirement age all year, there's an annual earnings limit of $24,480 for 2026. Earn more than that, and Social Security withholds $1 of benefits for every $2 you go over. You already earned $40,000. You're $15,000 over the limit before you even filed. So you do the math and you conclude the obvious thing: I've blown past it. There's no point filing this year. I'll wait until January. That conclusion is wrong. And it's cost people 5-6 months of checks they were entitled to. Because there is a second rule. Social Security calls it the Special Earnings Limit Rule. Most people know it as the first year rule. And it exists for exactly this situation. In your first calendar year of receiving benefits, Social Security can look at your earnings month by month instead of for the whole year. And under that monthly test, you receive a full benefit for any month you earn under $2,040 if you're under full retirement age. If you reach full retirement age during 2026, that monthly figure is $5,430. Read that again, because the important word is regardless. Regardless of the $40,000 you already earned that year. The monthly test doesn't care what January through June look like. It asks one question about each month after you file. Did you earn under the threshold in that month? Retired in July with no further income? Then July, August, September, October, November, December are 6 qualifying months, 6 full checks. In the same year, you earned $40,000. Now, which test applies to you is not something you choose off a menu. It's determined by the facts of your case. But here's the part that matters. If you never mention that you retired mid-year, the annual number is the one sitting in front of them. So, if the agency doesn't volunteer it, who's doing this math correctly for you? Nobody. That's the answer. Nobody is doing that math for you. And here's where it turns into real money loss, because the mistake people make isn't filing wrong. It's not filing at all. Think about what actually happens in that living room in July. A man runs the annual numbers, sees he's 15,000 over the limit, and decides the responsible thing is to wait. He tells his wife they'll file in January. It sounds careful. It sounds like exactly what a sensible person does. 6 checks, gone. Not withheld, never claimed. There is no back payment for a decision you made yourself. And the cruelty of it is that he did the math correctly. He just did the correct math on the wrong rule. This is the pattern you're going to see 3 times in this video, so notice it now. The system did not deny him anything. It answered the question he asked. He asked about the annual limit, so he got the annual limit. He never asked whether a different test could apply to his first year, because he had no idea that test existed. If you retired this year, or you're planning to retire before December, say, do not decide anything based on your annual total until you have asked Social Security directly about the monthly test. Ask for it by name. That's rule 1. Rule 2 is worse. Because with this next one, people apply, get told no, and that no can be wrong the moment the calendar turns. The program is called Extra Help, officially the Part D low-income subsidy. If you qualify, here's what it does. Your Part D premium goes to 0. Your deductible goes to 0. And every prescription you fill gets capped, $5.10 for a generic, $12.65 for a brand name. If you're also on Medicaid with income below the poverty line, it's $160 and $490. Social Security's own estimate puts the value at around $5,000 a year per person. Now here's what changed and why an old answer may be dead wrong. Before 2024, Extra Help had 2 levels. There was a full subsidy and there was a partial subsidy, a reduced version for people who earned a little more. And a lot of people landed in that partial tier or got told they were close to it and walked away thinking the program wasn't worth the paperwork. That 2-tier system no longer exists. The Inflation Reduction Act eliminated it effective January 1st, 2024. There is no partial tier anymore. Everyone who qualifies now gets the full subsidy, the same $0 premium, the same capped copays. The income limit for 2026 is $23,475 a year for an individual, $31,725 for a married couple living together. That's 150% of the federal poverty level, and it runs slightly higher in Alaska and Hawaii. And there's a resource test, about $18,090 for an individual, $36,100 for a couple, when you include the burial expense set aside. Your house doesn't count. One vehicle doesn't count. Your household belongings don't count. Bank accounts, CDs, stocks, and IRA balances do. Read those numbers, and a lot of people will do the thing I want to stop you from doing. They'll hear $23,000, compare it to what they made last year, and shut the door. Do not shut that door yet, because that number is not what you think it is. And the next 2 minutes are the reason millions of people who qualify have never applied. Have you ever been told you didn't qualify for Extra Help? Tell me what year it was. That year matters more than you'd think. That $23,475 is not your salary. It's not the number on your tax return. It's your countable income, and those are 2 very different figures. Social Security applies an earned income exclusion when it runs this calculation. If you're still working, part of what you earn simply doesn't get counted, which means a person earning noticeably more than $23,000 a year can still land under the limit once the agency does its own math. There are other situations that stretch it further. Living in Alaska or Hawaii or supporting family members who live with you. So, the honest instruction here is you cannot determine your own eligibility by comparing your paycheck to that number. Only Social Security can run it, and applying is free, with no penalty for applying when you turn out not to qualify. Now put that together with the 2-tier system disappearing in 2024. If you were told no before January 1st, 2024, you were told no under rules that are gone. If you were told you'd only get partial help and decided it wasn't worth it, that partial tier doesn't exist anymore. If you ran the numbers in your own kitchen and disqualified yourself, you may have used the wrong income figure entirely. An old number is not a current number. It's a decision made under a system that has since been rewritten. And nobody is going to call and tell you to try again. Third one. And this is the one with a clock on it. For years, the answer on weight loss drugs was simple, and it was no. Medicare Part D was barred from covering drugs prescribed for obesity. If a doctor put you on Wegovy for weight loss, you paid list price. And list price runs north of $245 a month, even after the manufacturer negotiations. That changed on July 1st of this year. There's a program called the Medicare GLP-1 Bridge. It runs from July 1st, 2026 through December 31st, 2027. Under it, an eligible Part D beneficiary pays a flat $50 a month. $50. For a drug that was categorically excluded from Medicare coverage for the entire history of the program. Now, 3 things you need to hear clearly, because this is exactly the kind of headline that gets repeated wrong. First, it does not cover every GLP-1. The program covers Wegovy, Zepbound, and Foundayo. And for Zepbound, only the KwikPen formulation. Different drug, different pen, and you're outside the program. Second, there are medical eligibility criteria, and they're specific. A body mass index of 35 or above qualifies on its own. Below that, you need a BMI of 27 or higher, plus a qualifying condition, hypertension, chronic kidney disease, prediabetes, or a cardiovascular history. This is not a program you enroll in because you'd like to lose weight. Your doctor determines whether you meet the clinical criteria. And there's a distinction here that trips people up. If you're taking one of these drugs for type 2 diabetes, you're in a different lane entirely. That coverage already existed under different rules, and this program isn't what's paying for it. The bridge exists specifically for the obesity indication, which is the one Medicare was barred from covering. Same drug, same pen, different reason written on the prescription. And the reason is what determines which set of rules applies to your claim. So when your doctor answers, the useful question isn't just whether you qualify, it's what indication they'd be writing it under. Third, and this one surprises people who are already getting help. Extra help does not stack with this. The low-income subsidy does not apply to that $50 copay. If you're on extra help and you assumed all your subsidies combined, they don't. $50 is $50. And that $50 doesn't count toward your deductible or your out-of-pocket total either. Now, the part that makes this different from the first 2 rules, the first 2 aren't going anywhere. The monthly earnings test is standing policy. Extra help is permanent law. If you miss them this year, they'll still be there next year. This one has an end date printed on it, December 31st, 2027. After that date, unless something is extended or replaced, these drugs go back to what they cost before. $245 a month and up out of your pocket. The window is open right now. It was not open 2 years ago. And there is a date on the calendar where it closes. If you're on Medicare and a GLP-1 has ever come up in a conversation with your doctor, that conversation is worth having again. This month, not next year. Are you on one of these drugs right now? What are you actually paying? Put the number below because people reading these comments are trying to figure out if their plan is handling this correctly. 3 actions. Do them in this order because only one of them has a deadline. The drug program first. Not because it's the biggest, because it's the only one that expires. Your first call is to your doctor's office, and the question is whether you meet the clinical criteria. But before you hang up, ask them one more thing. Which exact drug and which exact formulation they'd write. Then call your Part D plan with that specific answer in hand. People get to the pharmacy counter having confirmed the program, but never the product. And that's where the surprise happens. Social Security second, and here the wording is everything. Say this: I want to know if the special earnings limit rule applies to my first year of benefits. Say the name of the rule. Ask about earnings limits in general, and you'll get the annual figure correctly, politely. And it won't be the answer you needed. Have 2 dates ready before you call, the month you stopped working, and what you expect to earn each month after that. Extra Help third, and this one is a form, not a conversation. Apply at ssa.gov. It's free, and a denial costs you nothing. 2 things people get wrong at the finish line. If you're on Medicaid, SSI, or a Medicare savings program, you already have Extra Help. Don't apply, check. But if you applied on your own and got approved, approval doesn't put you in a drug plan. You still have to pick one. There are people walking around approved for a subsidy that's attached to nothing. And whichever of the 3 you're chasing rates our shape. Write down the date you called and the name of the person you spoke to. Every one of these depends on a determination someone makes about your file. If it comes back wrong, that note is the difference between appealing and starting over. 3 calls, maybe 40 minutes total. That's the whole cost of finding out. Go back to where we started, that $5,000 a year. It's still sitting there. Nothing in the last 15 minutes changed whether you qualify. You did before you clicked on this or you didn't. The only thing that changed is that now you know to check. Social Security and CMS estimate that 2 to 3 million people qualify for Extra Help and have never applied. Not denied, never applied. That number exists because nobody's job is to come find them. So, 3 calls. Your doctor about the drug program with the 2027 deadline. Social Security about the monthly earnings test by name. And the Extra Help application even if you were told no before 2024. Nothing here is financial or medical advice. These are public programs with real eligibility rules, and only the agency can run your numbers. But they'll only run them if you ask.